Anti-inflammatory, could probably replace about 70% of the steroids that are being applied to patients today. It's also very effective for burn healing. I'd love to be able to see this in burn units. It relieves the pain from a severe burn within 60 seconds. And as long as it's kept wet, there's no pain, and it accelerates the healing process. But that's because it's charged with cannabis. A lot of several other herbs and spices, but cannabis is the activator for the entire thing. Earlier today, there's been a couple of people that talked about the entourage effect of cannabis.
Can you give me some information about that?
Yeah, we talked about all these different strains, and a lot of times, most of the time, when they talk about the quality or the nature of cannabis, everybody talks in terms of how much THC does it have. And that's a great disservice and a great oversimplification to look at it simply as a THC delivery mechanism. We've been hearing about the compound CBD. For 6 months in Michigan, I held the record for having the highest CBD concentrate on record here in Michigan. I came in at 43.2%, and a concentrate, it was 42.3% THC. So it was, the concentrate was between the two, about 86%, something like that, cannabinoids, between those two cannabinoids. I used that for my own bladder cancer. It took 2 weeks for a 2 to 3 centimeter tumor in my bladder to be completely undetectable. 2 weeks. And that's by using a combination of CBD and THC. We're finding that the optimal amount of CBD in that mix, if you're going to go that way, mixing the two, it should be approximately 10 to 25% CBD mixed in with the THC for anti-cancer purposes. For these epilepsy patients, these minors. Now this is phenomenal. We've had 25 or 50, depending on which account that you're looking at, patients accepted into the investigational new drug program conducted by the FDA. New patients haven't been accepted into that for decades. There's only 4 patients left that have been getting their marijuana from the federal government for the last 30 years. They're getting high CBD as being provided by GW Pharmaceuticals. GW Pharmaceuticals has been showing CBD is advantageous, but more than that, they've been showing the benefit of mixing the two together. That when you mix the two together, you know, THC may be able to do this much, CBD may be able to do this much, but when you mix the two together, you breach that wall and you're able to do much more than you would with either one individually. It's called, it's a synergy effect. And pharmaceutical companies have been doing that very well. They've been putting together drug cocktails, for instance, for the treatment of AIDS patients, where they have 2 or 3 drugs simultaneously being applied instead of one individually. Well, the marijuana plant has 400 to 600 compounds that all interact together to produce a unique effect for that one particular patient. A different human may respond different to that particular strain. The complexity of the plant is infinite. It is infinitely complex. You could make one strain for every human on the face of the planet. The same with the children. They're finding that extremely high CBD amounts are very good for that particular condition. Each condition, each patient within that subset of conditions is going to represent a different optimal pattern of materials. So the cannabinoids and the terpenes, the compounds that make up the smells and things like that, those all interact together to provide a unique plant for that one moment. Nowhere near what these folks are able to represent. One strain, they're nuts. That's not what medical marijuana is all about. It's about the uniqueness and the individuality. I'm promoting a cannabis a cancer project right now. Want to have 20 samples, get a sample of the patient's cancer, culture it in about 20 different dishes, take 20 different strains, apply concentrates of those 20 different strains to each one of those samples and see which one does the best for that particular cancer patient. Which plant, little cannabinoid factory, is sitting right there producing all of these cannabinoids that are just going to be the perfect one for this cancer patient. We can do this with off-the-shelf technology right now today. Any questions? That's the entourage effect. Marijuana is an orchestra of instruments playing a song to a human body. It's very, very different than listening to a violin solo.
It's a symphony.